Hello to our friends in close to 1,000 hospitals all over the world that use or have used the RULTRACT at one time or another. My name is Philip Rulo with RULTRACT, and I wanted to quickly go over something that was brought to my attention recently, and that is, how should my RULTRACT be brought into the OR? Now, obviously, I know it comes in a sterilization container, but how should the RULTRACT be assembled when it comes into the OR? So quickly, I will tell you that your RULTRACT ratchet rake assembly should be completely assembled for sterilization. So this is what it's going to look like in the tray. Some RULTRACTs do not have a rake plate, so the rake plate would not be on the snap clip when it comes into the OR. And of course, there is also the option of not putting the rake plate on to the snap clip, so it may come into the OR like this, but it should be assembled completely. And in most cases, the rake plate is going to be attached to the snap clip. So of course that would go into your tray like that. Be very careful, those rakes are sharp, as I'm sure you all know. Next, the set that you use is called a combination clamp set. So for the purposes of this video, we'll discuss that. This clamp should be just the clamp. Now, of course, you want the jaws to be somewhere in the middle for sterilization. You don't want them all the way open or closed, but when it goes into the tray for sterilization, it goes in as a standalone piece. Reason being, you do not want to put this post into the clamp and then tighten it down for sterilization. Our sterilization parameters were not tested that way, so we can't be positive that in this area it's sterile. I feel confident in saying that it most certainly would be, but our parameters do not address that. So these two pieces have to be separate when they go into the tray. Standalone piece, standalone piece. Furthermore, if you have a tray that's extremely long and you're able to attach these two pieces and put them in the tray, you cannot do that either. Our sterilization parameters do not cover that. Reason being, of course, this is a 3-inch sleeve covering very fine spline cuts into the top post. If you put these two pieces together, our parameters are not tested to say that what's in here is going to be sterile, so they need to be in two pieces. The next thing is, it's also brought to my attention that there are times when SPD is being asked to put the ratchet assembly onto the top post for sterilization. So then it would come into the OR like this. Again, our sterilization parameters have not been tested with these two pieces together, so we cannot say that it is okay to do that. Reason being here is your top post has what we refer to as detents, and you can see those detents go all the way around these top posts. So if you put this ratchet assembly onto that top post and then you tighten your lock knob down into a detent so it doesn't fall off, we cannot be certain that inside this area down into that detent is going to be sterile, because again, our sterilization parameters are not tested for that. So these cannot be together for sterilization. So when the equipment goes into the tray, it needs to be in separate pieces, which means when it's sterilized, it needs to be in separate pieces, and therefore when it gets into the OR, it's going to be in those separate pieces. So that is the way that our sterilization parameters are tested, and that is the way it is supposed to be. If you have any further questions, please email me, call me, text me, and I can discuss that with you further. Thank you for your time. Have a nice day.